Guys, my name is Dr. Mona Hardas. I'm an OBGYN from Flint, Michigan. I am a board certified OBGYN. I'm a cosmetic gynecologist. So one of the topics I wanted to talk today is about birth control. There is so much misinformation about the birth control that I decided let's talk about some of the concerns you guys have. As a gynecologist, at least 100 times a day, I talk about birth control. And sometimes I ask a question, hey, what are you using for birth control? And then the patient kind of get a little hesitant and she's like, I don't use anything because I'm worried about side effects. What side effects is what I want to know. And I say, hey, do you know that if you don't use any birth control, you can get pregnant, right? And sometimes my patient will smile, shrug, and say nothing. And sometimes she's like, yeah, I know, but I don't know where to start. And that's when we start talking about what are your concerns, what are you worried about. One of the major concern a patient has is weight gain. I don't want to gain weight. I don't want to because I have seen so and so gain 20 pounds as so and so, some of my friends or cousins or whosoever gained weight. Okay, let's step back and look at weight gain. You know, weight gain is very easy, right? You can gain weight because you didn't eat right, you did not exercise, your diet gone crazy, whatever. It could happen that you are on a birth control at the same time and you are blaming the birth control. Now there are so many studies done about weight gain and birth control. And one consistent birth control option which has shown some weight gain is depo-provera shot. Not the pill, not the patch, none of those, the ring, none of those have shown any weight gain. You may gain a little weight, I'm not saying no, but not a crazy amount of weight. And you can very clearly and consciously control that weight gain if you watch what you're eating, if you watch your exercise level and your activity level. But depo-provera, yes, up to 10% weight gain has been seen. But again, when you get your depo shot the first time, in first 2-3 months you're gonna see the weight gain. But it's not like every month you're gonna keep gaining. So if you're interested in it, let's sit down and talk about depo-provera and see what we can do to limit the weight gain or give you a different option. Now many people say that, hey, I don't want any hormones in my body, I'm just gonna use a natural family planning. Okay, what is natural family planning method? It is accepted, I'm not saying it's not, it's an accepted method of birth control, but the failure rate is as high as 25% as compared to the hormonal options, which is only 1% or less. So you must have seen all these apps on the phone which are there for a natural family planning. And the way this works is that at the time of ovulation, there's a change in the temperature of your body. Number one, your body or your cervix makes more mucus. So there's a change in the cervical mucus and is a change in the position of the cervix. Those are the three things you have to watch for to see whether you should have sex that day or not. Because on the day of ovulation, when the temperature rises or you have more mucus supply or the cervix has moved up, and those days you need to avoid having sex so you can avoid pregnancy. So few things. You need to have a very regular, consistent menstrual cycle. People who have irregular menstrual cycle, this does not work. Because number one, they may not be ovulating at the same time and you wouldn't know and you might have escape ovulation and get pregnant. So consistent regular menstrual cycle is important. If you're a teenager, you are in perimenopause, you just had a baby, or you are breastfeeding, this method is not gonna be successful for you. So remember before you start doing that. Number two, you have to check your temperature every single day. as soon as you get up in the morning. Not after you get out, brush your teeth, do anything else, right? First thing in the morning, you have to take your temperature and chart it. That is very important because the temperature is not a straight line. It's all over the place in everybody because it's affected by so many different things. And at the time of ovulation, there's a increase. And if you miss that, you'll miss that day of ovulation, and if you're sexually active, can get pregnant. Number 3, you have to really watch your cervical mucus and be able to read, because at the time of ovulation, there is the cervical mucus is very thin. It is like an egg white. It's very stretchy. So if you can read those changes, then natural family planning will work for you. Just don't go by the app which tells you, oh, you're ovulating today. No, because everybody is different. Everybody's body is different. So if you want to use that, I'm fine as long as you follow all these rules, okay? If not, let's talk about hormone-containing birth control. As I told you, weight gain is a myth. It's not associated except with the depo-provera only. The second thing people worry about is the irregular bleeding while they are on a birth control. Can happen with depo-provera for first few months, can happen with Nexplanon, which is the implant which goes in the arm for first few months. Not as common with a birth control pill unless you are not taking it on time. Nowadays the birth control pills are very low dose, right? So it has a very short amount of an action, and if you are not taking it on time, then the hormone level will decrease and you start bleeding. It can also happen is the amount of hormone is not right for you. So you need to write it down and talk to a gynecologist about it. Irregular bleeding with the IUDs is also seen, again, more common in first 2 to 3 months where your body is getting used to it. So if irregular bleeding on one birth control option is something you're worried about, we can try different option. We can tweak the dosage of the medication, but we can definitely help you. So don't stop using it because you've been bleeding irregularly. The third common question I get asked is about, again, coming back to depo-provera, how long can be on it? Some people love it because as the time goes by, they don't have a menstrual cycle. Now, you can be on a depo-provera for a very long time. There's not like a time limit for it. Few things you have to consider is like, are you going to be planning a pregnancy? If you are, then with depo-provera, it may take 8 to 12 months before your ovulation comes back. And if you're planning it in a near future, it may not be a bad idea to change you to a different option. So, whenever you're ready to try, the ovulation is there. The other thing people worry about is a low bone mass. Like it decreases your bone mass and makes you more prone to osteoporosis later in life. But remember, this is a reversible process. As soon as you stop depo-provera, the bone mass will come back to normal. So if this is the only option which has worked out good for you, or this is the only option available to you where you are, it is more convenient and you love it, then stay on it. Don't go off it unless obviously you're planning a pregnancy, or you're completely done with your childbearing and you want tubal ligation or something like that. Now, the other confusion people have is about Nexplanon. Nexplanon is that little implant which goes in the arm, and in USA, FDA has approved it for 3 years. Now, I know in some of the other countries, in Europe, Asian countries, it might be approved for longer than that. But in our country here, it's only for 3 years. So my suggestion to you, or my advice to you, is to just use it for 3 years, and we can change it after 3 years. And again, if you are worried about an abnormal bleeding on Nexplanon, please contact us. There are medications we can give you to control the bleeding. No need to get rid of that birth control option completely just because you have been bleeding irregularly, right? So the other question I get asked is about the IUD, especially the Mirena IUD. Now for years and years we used to say Mirena is good for 5 years, and most of the people know that. Now the recommendation has changed to 7 years. So people are getting confused about that. So yes, you can use Mirena IUD for longer than that. So if you have it, you don't have to remove it in 5 years. You know that, right? That you can get that removed at any time. You don't have to wait for 5 or 7 years. Anytime you come in, you don't like the IUD, or you're having side effects from IUD, or you want to try a different option, we can always do that. But if it's working out great, then you can leave it there for 7 years or so. A lot of people have questions about a non-hormonal birth control which is out there. Phexxi is one of the newer ones which is out on the market, and what it is a vaginal gel, and it changes the pH of the vagina, and that's how the sperms are not they're killed, or they're not motile when Phexxi is used. Now you don't have to use it every day, you just use it right before sex, and it's very effective. Its failure rate is only less, I think 5%, 4 or 5% or so. So that's option out there if you are like totally against hormones. If you want to try something different apart from condoms, which has a higher failure rate, please talk to your gynecologist. And Phexxi is on a prescription basis, so we can give you the prescription and you can trial it, right? People are worried about how long can they be on a birth control. My gosh, there is no set limit. You can be on years and years and years. As the birth control options, the hormones have been out there and been studied for so long, and we have not seen any association between the number of years you have been on the birth control and infertility. Birth control, especially the hormones, do not make you infertile. Read my lips, it does not make you infertile, okay? What happens is that once you stop taking birth control, it may take 2 to 4 months for your ovulation to come back, especially with the combined hormones. And that's the time you will not get pregnant, but that does not make you infertile. You will start ovulating. With depo-provera and Nexplanon, though, it may take up to a year, and that's why you have to plan it ahead of time. But birth control itself does not make you infertile at all. Now that brings me to this last question, because my patient said, what do you think is the best birth control? Can you just put me on the best one? Well, all of them are good birth control. The best birth control is gonna be the one which is the right for you. If you have other questions, please call me. Please come see us. Let's sit down and figure out what is the best birth control for you. We'll get you on something good you're happy with.